Rheumatoid arthritis is a chronic systemic inflammatory disease of unknown cause. An external trigger, for example, cigarette smoking, infection, or trauma, triggers an autoimmune reaction, leading to synovial hypertrophy and chronic joint inflammation, along with the prospect of extra-articular manifestations. It is believed to occur in genetically susceptible individuals and more common in middle-aged women. Causes unknown. Autoimmune disorder and likely a combination of genetic and environmental factors. Symptoms are joint stiffness, painful joints, swelling of affected joints, deformity of affected joints, limitation of motion, skin nodules, difficulty in breathing, easyfatigability. The signs that are usually elicited are persistent symmetric polyarthritis, as synovitis of hands and feet. Also, joint stiffness, joint tenderness, joint swelling, joint deformity, limitation of joint movement, rheumatoid nodules, signs relating to extra-articular movement. Also, for example, lung disease, uveitis, pericardial or pleural effusions. Investigations are FBC, ESR, C-reactive protein level, rheumatoid factor assay, anti-nuclear antibody assay, that's ANA assay, and anti-CCP, is anti-cyclic citrullinated peptide. Also, joint aspiration and analysis of synovial fluid, hepatitis B and C test, HIV test, X-rays of hands and feet, MRI of cervical spine to detect subluxation, and also ultrasonography of joints. The main treatment objectives are to relieve pain, swelling, and stiffness, to prevent deformities, to delay disease progression and long-term complications, and to reduce drug side effects. Non-pharmacological treatment, heat and cold therapies, orthotics and splints, physiotherapy, occupational therapy, adaptive equipment, joint protection education, counseling and education, synovectomy, tenosynovectomy, tendon realignment, and reconstructive surgery or arthroplasty and arthrodesis. Pharmacological treatment, symptoms present more than 6 weeks. Well, antibody positive, that when symptoms present more than 6 weeks or antibody is tested positive. First line treatment, you give prednisolone oral 0.5 to 1 milligram per kilogram body weight. You take corticosteroids after food. High dose glucocorticoids may cause insomnia, and immediate release formulation is typically administered in morning to coincide with circadian rhythm. And also omeprazole oral in adults 20 milligrams daily. In children more than having a weight more than 20 kilograms, give 20 milligrams daily. 10 to 20 kilograms, 10 milligrams daily, and 5 to 10 kilograms, 5 milligrams daily. Or you can give esomeprazole oral in adults 20 to 40 milligrams daily. In children 12 to 18 years, so give 20 to 40 milligrams daily. 1 to 12 years, so give 10 to 20 milligrams daily, and less than 1 year is not recommended. Or you can give diclofenac oral in adults 50 milligrams 8 hourly for or 100 milligrams 12 hourly as required. In children more than 12 years, give 50 milligrams 12 hourly as required, and less than 12 years is not recommended. Or diclofenac rectal in adults 100 milligrams 12 hourly as required. In children more than 12 years, give 75 to 100 milligrams daily as required. Less than 12 years is not recommended. Or you can give celecoxib oral in adults 400 milligrams stats, and then 200 milligrams 12 to 24 hourly as required. In children more than 2 years with a weight more than 25 kilograms, give 100 milligrams 12 hourly as required. More than 2 years and weight 10 to 25 kilograms, you give 50 milligrams 12 hourly as required. Less than 2 years is not recommended. And paracetamol oral in adults 50 milligrams to 1 gram 6 to 8 hourly as required. In children 6 to 12 years, give 250 to 500 milligrams 6 to 8 hourly as required. 1 to 5 years, give 120 to 250 milligrams 6 to 8 hourly as required. 3 months to 1 year, you give 60 to 120 milligrams 6 to 8 hourly as required. And then you give calcium supplements. In adults and children, you give as required. The maintenance therapy for symptoms presenting more than 6 weeks or antibiotic positive. First line treatment, you give hydroxychloroquine, or you consult a specialist. And also sulfasalazine, methotrexate, and leflunomide. So all these, you consult a specialist, or you can give etanercept or infliximab, adalimumab, certolizumab, and golimumab. So all these, you consult a specialist, or you can give rituximab or anakinra. That's anakinra, abatacept, tocilizumab, and tofacitinib. So in all these, you consult a specialist. The second line treatment, you can give cyclosporin. This, you consult a specialist. And azathioprine, you consult a specialist. And also you can give gold dust, gold salts. This, you consult a specialist too. And also you can give penicillamide. This one too, you consult a specialist. Or minocycline. So in all these, you consult a specialist. So referral criteria, refer all cases to a physician specialist or rheumatologist.